It is one of the biggest problems in delivering high-quality health care, a failure to communicate. Patients don't always hear doctors, and doctors don't always hear patients. Joining us for this week's Your Health segment is Donna Jacobs, Senior Vice President of Government, Regulatory Affairs, and Community Health at the University of Maryland Medical System. Thank you for being with us.
Thank you for having me.
So this is broadly referred to as health literacy.
Exactly.
And 9 out of 10 people can have an issue with it.
9 out of 10 people. It affects almost all of us at some point in our lives. And the issue is being able to obtain, process, communicate, and understand basic health information that allows you to keep yourself healthy or improve your health status. What happens is doctors and other providers often speak their own language. It may be complicated. The patient may even be under stress, which is more likely to create a situation where you do not understand what you're being told. And oftentimes you're given a lot of information in a short period of time, and it's a lot to absorb. Imagine if you're stressed. Imagine if you've gotten a difficult diagnosis. It's hard to really take in everything that's been said to you. But it's critically important that patients walk away understanding the information they're being given.
People may think this is somebody else's problem, but even people at the peak of some other non-medical profession, you're a scientist, you're a teacher, whatever you are, you think you're pretty smart, but you get into one of these compact 10-minute high-intensity discussions and find that the two-way communication just isn't working right.
Well, imagine this. So in any environment or any segment of the workforce, people have their own language. In television, I imagine you have your own. I wouldn't understand everything
yes,
that you say. So when you come into an environment that's different and difficult, and you're hearing words that are not the everyday parlance for you, it's hard to decipher all of that. And so we have to remember to look at it as a two-way street. It's really both parties, the provider and the patient, that have to take responsibility to ensure that that's a two-way dialogue and that patients know what they need.
So as a health system operating a number of hospitals and clinics, what do you do about it?
Well, we at the University of Maryland Medical System are taking this issue very, very seriously. We've created a video that we're providing to all of our providers, anyone who's delivering health care, so that they are certainly aware of the issue and understand that they need to look at every patient similarly. You can't just look at someone and say he or she has a low level of health literacy. It may be anyone, if it's 9 out of 10 people, and if in a stressful situation, it's virtually all of us. So creating that awareness is number one, and encouraging providers to talk to the patient and then ask a patient to repeat what's been said. Tell me in your own words what we've discussed here. Really engages the patient and gives the provider an opportunity to hear whether or not that patient has understood what the discussion has been about. So that's helpful. We've also created a set of guidelines for, it's not just the spoken word, but it's also the written word. So for anything that we produce, we'd like to have it in plain, simple language, non-monosyllabic words, putting the important information up front, lots of white space on a page with an opportunity for patients to comment about it.
So the model of what not to do is probably that piece of paper you get from the pharmacy that comes along with some even routine prescription. It's a page, it's 2 pages or more of dense, single-spaced, tight lingo that nobody outside the pharmacy world could understand.
Right, so you always want to be sure that the basics are what people get. And medication management is one of the difficult areas, as you might imagine. Patients don't understand sometimes what medication they're taking. They may not understand what it does, what the contraindications are, what medicines you could take that will counteract. They don't know all those things. So making sure that a patient is able to give their health history completely so that a provider knows what that is and can respond and can provide the information is key. But what is it and how does that patient take the medication? Is it 4 times a day? That doesn't mean 4 pills at once. Is it twice a day? That doesn't mean 2 at once. That may mean 8 or 12-hour separations. So those are complicated areas.
Let me remind our viewers, if you have a question about health literacy, give us a call. We'll have the number on the screen. You can also tweet your questions to @MPTNews. One piece of advice that makes so much sense but isn't always practical is taking somebody with you.
Absolutely.
As a facilitator, as just another set of ears.
I think that's great advice, especially when you know you're in a situation with a difficult medical complication or a difficult diagnosis. And let me give you an example, and this happens all the time. When someone has heard the word cancer in a diagnosis, that is likely the last thing that they hear the provider say. There are hundreds of different kinds of cancers. The way that they're treated are all different. The prognoses may be different. The time to treatment, time to begin, all of that is very relevant and important information. The patient has zoned out, I assure you. So having someone else there who can take notes, who can help ask questions is critical.
Let's take a phone call. George in Anne Arundel County. George, thank you for calling. Go ahead.
Good evening. And thank you, Jeff, for having on such a well-spoken, competent guest here. And I'm interested in knowing whether physicians have the opportunity to, with Medicare, Medicaid, and with insurance companies, to check an extra box when they're submitting claims that allows them to get compensated for some extra time that needs to or should be spent with somebody when they're diagnosed with a life-threatening issue, so that they can take a little extra time to both not only take care of the strict medical issue, but also the personal and psychological issues that go with it.
Very good. Thank you very much. So in the situation you were talking about where somebody's hit with the C word, and the 15 minutes, whatever it is that's allotted for the appointment is almost up.
Right.
Can you get some overtime somehow?
So I'm not aware of any box that people can check in order to do that, but oftentimes physicians will have a team within their office that can help provide some additional information. Many times when you have a difficult diagnosis such as that, the physician will just naturally take the extra time to provide the assurances that you need. But if that's not possible, many will have others in their office try to provide the time and the information that you need. It's a fair enough question. And there clearly are stresses in terms of how much time is allotted to spend with patients. It's a challenge.
It is. Let's go out to Anne Arundel County. This is Ram. Thank you for calling. Go ahead. Hello, are you there?
Yeah, I'm here.
What is your question, sir?
Yeah, thanks for giving me a time, and good evening. My question is, the guest is talking very wonderful things. I am with her, but the main points what she described. But I'm trying to find a physician who can honor all these guidelines. Actually, when I go to the physician, he always starting watching his watch, how much minutes he's going to consume. At the same time, he don't like the patient who is having a good knowledge of the medical thing and doing a research and asking questions. So how do the patient handle this situation?
You're saying the doctor doesn't like the patient having knowledge of the situation?
Yes. If he has some own research and ask questions about the medication, if the satin is good or not, he's not comfortable answering that question.
Interesting. Thank you for the phone call. Your thoughts?
I understand that question. So when you identify a physician, this is a two-way street, and you need to build a personal relationship with that physician. Because you have gone to someone once may not dictate what you're going to do in the future. You need to find a person with whom you are comfortable, with whom you can ask questions fairly and not feel judged. This is your personal health care. These are decisions that you're going to have to make about yourself, but, well, that you should be making jointly with your physician. And so you should find a level of comfort.
But as you say, nobody cares more about it than you do.
Right.
And you got to look out for number one. I've heard it suggested that a patient could make a list of questions so that in the heat of the moment you don't forget it. On the way out the door you remember, right, I should have asked so-and-so. And even print it out, take it with you, and show it to the provider.
You absolutely can do that, and I am one who does that all the time. I will have a list probably of 20 questions, and I want them answered. Now, people may not be as extreme as I am. You can just do three simple things. What is my main issue? What do I need to do about it? and why is it important? So for instance, if you go to a doctor and they've said you're hypertensive, this is a word that may be used, that's not necessarily a health literate word. High blood pressure, that's what the patient will understand and needs to know, and we should say that to everyone, not just certain patients, as I said earlier, that we select. So you tell the patient that they're hypertensive, they're given medication to take on a regular basis, daily. The person needs to understand that if you stop that medication for some period of time, you're going to go back to that same situation of hypertension. So the physician needs, or the provider needs to explain the whole continuum of what can happen so that the person understands the downside of not taking the medications appropriately.
Let's go out to Prince George's County now. This is Kathleen. Kathleen, thank you for the call. Go ahead.
Yes, my question is, how do I get the provider to give me a paper that I can read, something that I can read, about what we've just talked about? I mean, I will get a follow-up, kind of, but it doesn't have everything that we've talked about on it. I mean, I understand there's a difficulty here.
Kathleen, that's a terrific question. Let me get an answer to that. But one thing that may be changing is the technology.
Right.
More offices are computerized, more medical records, and even my primary care. You go in for a routine thing, on the way out the door, they hand you a piece of paper with the notes about what just happened, and that's terrific.
Right. So more and more physicians are using electronic medical records, and you see them keying information into the computer. It's certainly something that we do here at the medical system. You can also ask the provider to give you a printout about the diagnosis, the disease, the issue that you're talking about. If they don't have the time to give you specific information related to you, you can at least have some summary information available.
What's the best way for somebody, short of getting sick, what's a good way for somebody to become more health literate and to get the benefit of what somebody who's experienced with the system knows in how to deal with providers?
Well, you can always talk to, one of the areas that's really burgeoning right now is called community health workers. And these are people that are more and more being employed by hospitals to help hospitals think about well care and keeping people healthy while they're in community. Usually community health workers come from the community you live in. They are familiar with the people around them and can speak the layperson's language and help be a bridge and translate information from the patient to the provider.
Terrific. Donna Jacobs, Senior Vice President, University of Maryland Medical System. Thanks for your time.
Thank you.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.